This is All Things Fitness and Wellness, uniting industry thought leaders and fitfluencers on the mission to inspire innovation and encourage people to live a life fit and well. Brought to you by British Columbia Personal Training Institute. Learn how to train, gain, and retain clients. Visit bcpti.ca. Today we hear from Jose Teixiera, who's the head of customer experience for SC Fitness in Portugal. He's going to be speaking to the present challenges due to the global energy crisis and provide valuable data-driven insights for growth opportunities for fitness professionals. Before we get to it, be sure to hit like and subscribe. We have new episodes of the Industry Series every Monday and the Celebrity Series every Wednesday. This is ATFW. We know consumer behaviors have changed greatly over the last couple of years. So what are some of the top things that you're seeing as everyone's returned back to these physical spaces that they really want out of their fitness experience?
We've mapped our customer journey. We call it routes and routines. So we map every segment of customer, what's the route, if they work out in the morning or at lunch, where do they come from? Are they coming from work, from their house? So we kind of mapped all the things. And then COVID hit us, and now we are seeing some changes. We are redesigning the way you deliver service, because before COVID, people went from work to the gym, and now we are seeing a lot of people coming from home to the gym. So it's a big change. The number of the time you have to work out. We normally tend to ask 2 or 3 really important questions to members at the beginning on the onboarding. Of course, the goal, and 2 questions that kind of map what they want to do. One is how many hours can you work out, or how many days can you work out a week, and then what do you like to do? This approach gives us more information about their lives and what they want to do. If the member says, I'm only able to do twice a week, and we obviously know that people need more, we are able to prescribe home exercises or give access to our online platform so they can do it at home or outdoor. So a lot of things change, and a lot of things have changed as people are more aware of physical activity in their normal environments and not only the gym. So we are still mapping a lot of routes and different routines, but we saw a shift, especially with older people. That when you have a routine or a habit and you replace them because you are not able to do going to the gym, you are not getting the gym back. So some people just change our space in their Tuesday or Thursday to do something else, walk with their dog, or just walk in their home, or just climbing the stairs, whatever it is. It's really difficult to create a habit, but it's really easy to lose it. So we are still looking at it because we saw some huge changes on dynamics. See the commuting from work to home work, they changed a lot, mainly on corporate areas. So we are now redesigning the new journeys we see with this new membership we are facing right now, a younger membership. We can see some data that says that the landscape is changing, obviously.
For health club operators, where would be some of the primary areas you think that they should concentrate to garner these members to increase their retention and their experience in the physical space?
Of course, retention is a problem. Everyone has it, so it's easy to tell that. The thing is, I don't think most operators know what the problem really is. So the first part is information, is data. We have a lot of data points. We have a lot of information about the customer. We have behavioral information. We have a lot of things that are variables that affect the length of stay. If the member has a contract or not, if the member, the age, generation, the gender, if all the physical activity information, if they have a background of exercise, if they are new to exercise, what kind of activities do they do, what time of the day, etc. So you have a huge amount of data points, and you can track difference between what happens uh, with each member. And then you can also see, because you have access to the gym, you can see exactly, we call it here the fitness cliff. It's the moment when you start losing usage. It's about the 40th to the 60th day after you join, you start losing usage. So you have to reverse engineer it and try to put touch points to increase member journey if they do physical assessment. So what we did at the end, just to pick it up and to do as a process, we found out that members leave the clubs because they lack usage. That's we have obviously a more administrative thing, that's the contract. But I'm not going to talk about the contract. I'm just going to talk about things that we can do on the member journey. You can deliver first. The first point of contact is the physical assessment, and you must do at least 1 month onboarding to the member. So that's the beginning of the journey. Of course, you have to do during the journey, etc. But the beginning is the most important part of it. If you want to start to create an habit, you have to develop touch points all across the first 30 days to try to keep them involved. There are some studies that say that members create habit when they come 4 to 5 times a week during the first 6 weeks. It's huge. It's really difficult for us to get members so involved in our clubs, but we can deliver at least the first part of it. So our company focus a lot on giving physical assessments. Our goal is to have 85% of members do and complete a physical assessment. We have experienced users that don't want to, and we have members that just don't show up. But at least our goal is to have 85% of all physical assessments. And then we have another goal, which is really important for us, is that we have 0% of members that in the first 20 days don't come to the club. And we started with 25%. So imagine the number, 25% of all our membership in the first 20 days didn't show up. So if you don't show up in the first 28 days, you are not going to show up. You are going to cancel your membership. So we have a myth. I think it's a worldwide myth. The best customer is the customer who doesn't show up at the club. We know this is the opposite. If your customer doesn't show up, you are going to leave early. So we lose almost 2/3 of our cancellations are members who don't come for at least 60 days. A lot of things operators should focus, but my advice is to look at the data that supports your own variables, because all around the world you see different things, different behaviors, but the usage behavior is by far the most important variable.
Well, and the thing that's nice is even if it is that sales relationship that's getting them through that retention journey, that service is also something that adds so much meaning to their life. If you successfully get somebody to embrace the habit of physical wellness, what a mission.
We are in the a good business. So at the end of the day, you give health to people. So we are really blessed that we are in an industry like this. So, and that's why we also talk about health and the importance of people working out, not just for aesthetical reasons, but also obviously because it increases your health, it increases your life expectancy. So isn't it important for us to try to, I know this is a long-term thing and your brain doesn't process long-term benefits, but we need to continue to develop our own advocacy that we are not luxury, we are essential, but it will take some time to get there.
Well, and it seems like a lot of global voices are uniting around that premise. And I think with good reason, because for our situation here in Canada, for example, we have our universal healthcare system that is very stressed right now and spending a lot of money on chronic diseases that we know could correlate and be prevented in a lot of ways from physical activity. I know that WHO just came out with their physical activity report, What were your thoughts on what came out in that report in regards to the standpoint of the relationship or bridge with health club operators? And you can be candid.
You know, I'm happy and I'm sad at the same time, because the first part of it, everyone agrees, physical inactivity is a disaster. So everyone knows that. If you don't move, this is a disaster. And the report acknowledged that. So this is good for everyone that's within the sphere of physical activity, like we are. So everyone knows that if you don't move, it's a huge health problem. It burdens your health system, blah, blah, blah. Everyone knows the talk. My only problem is that I feel that we miss other things that are as important as saying the phrase physical inactivity is a problem. Yes, we need to act fast. Yes, some government funding is needed, but every industry has strong private companies that drive businesses. So the governments all around the world don't have enough money to give this kind of activities for free, even though the intention is good, and I agree that the intention of the report is good, but it misses a huge important part of the ecosystem. Is that fitness operators do marketing and have a huge penetration on physical activity. If you just replace gyms for other activity, you'll get a huge backlash on the numbers of physical activity. So if your country is like 10% penetration, if you took gyms of the equation, it will be far worse. And it's just not, it's utopical to say that we must provide free environment. Our business, you can do it, your physical activity, you can do it if you want at your home, outdoor, for free since the beginning of times. Why do people don't do it? Because it's not easy to do it mentally. So people want us, and Philip Mills has a really good line about this. People want results and they lack motivation. So what is the best place to get motivation? That's why I'm against health clubs looking just to on the health part of it. You must do both of them. You do the health part of it, but you must entertain people. If not, we are hospitals, and we are not hospitals. We are the good part of your life.
Turn your passion for fitness into a career with British Columbia Personal Training Institute. Taught by personal trainers, BCPTI combines classroom and in-gym training to give you the tools needed to succeed in the fitness industry and make an impact. With a simple formula focused on service, science, and sales, prospective personal trainers learn how to gain, train, and retain clients. Visit bcpti.ca for more information.
People enjoy, you see people with a smile. We want that. So gyms are the correct environment. The report says the only part it talks about gyms, it's about free gyms, free outdoor gyms. So that's a work that federations and associations like ours is doing with them to try to get. But we can help institutions to develop physical activity all around the world. But I do feel that sometimes governments want to solve problems they cannot solve. So you must, and this is maybe it's ideological, but what we see is that good policies around physical activity are more cultural than political. So if you have good cultural approach, gyms will be full. You have a lot of gyms. You have outdoor. You have everything around it. You see that with the Nordic countries in Europe. It's the culture that drives the physical activities, not if you do it for free or not. Because gym penetration in Sweden and Denmark is around 25, 26, 27, almost 30% penetration. So it correlates if the culture is more important. So if I was running WHO, I would address it as a partnership using all stakeholders. And sometimes institutions don't want to have and I understand that they don't want to have commercial relationships. We don't need to have. We just need everyone to work their part on the business. So health clubs are obviously a huge part of the solution. You cannot see physical activity without looking at gyms. If you compare sport, gym as a sport, we are the most important sport in the world. So why don't we market it? Why don't we take advantage of that? I think in the next 20 years we are, because I see the new generation coming to inside gyms as they were never before. So I'm really confident that despite COVID and despite the post-COVID era is not so wonderful because we are still recovering, but I see the long-term projections as with huge optimism.
Well, and you touch on such a good point there, because I think even if you spend time in social media spaces and you see fitness consumers speaking to their experience, it really is that shift that's leaning away from the aesthetic aspect of it and more what they are gaining in regards to mental health and how it's filtering into other aspects of their life. Almost everyone that I've talked to in this space has had their why and their reason and an understanding of what it's done for them. And I think what better advocates than to motivate other individuals, like that 80% that's not taking advantage. So on that note, you did touch on there how the industry obviously still dealing with its recovery and its challenges, and we want these spaces to be able to grow and prosper for this future subset. So what are some of the biggest challenges that are being faced in this recovery phase?
We lost members that we didn't recover because they replaced our time by other activities, like baby boomers for other activities. Obviously, we lost not as much as people thought, but if you lose 10%, it's still a huge number to digital, outdoor, whatever. We also lost some personal trainers on the industry, and they got members outside our physical ecosystem to their studios or their Zoom, WhatsApp, whatever is the platform. So we lost that members, and some business models are not re-attracting those memberships. So first part of it is we see different recoveries regarding business models. If your value proposition is good, I see 95 to 100% pre-COVID numbers. If your business model is not adapted, we are seeing 70%, 65% recovery. So members will come back to environments they want and they feel comfortable with. So this is one of the challenge. The same business model that were profitable in 2019, maybe they are not profitable right now. You can see boutiques facing huge problems with the pay-as-you-go model versus subscription. You saw big low-cost operators that people don't want to be on a really crowded environment. You saw different kinds of movement, pricing wise, etc., that now the business models are obsolete in 2 years. So and the speed of change is not, it's faster than it was 10 years ago. So we saw an acceleration through the fitness landscape, and it's getting faster and faster. So we will see. And the big operators like Apple and Google are launching physical activity or fitness programs through our smartphones. So we will get more competition than we had before. So that's one of the challenges, people recovering. The other challenge, of course, is when COVID happened, we started to take off our fat. So extra costs. Yes, some redundancies on staff that everyone has when you are. Just a quick note: our company, we have around 40 clubs right now. Uh, almost all of them had their top historical membership in February 2020. So we were at the top of our game when COVID struck. So we had some redundancies. So within the pandemic, we started cutting resources and cutting some things that we found out, well, we can live without this. And when we reopened, we said, even if we don't get 100% membership, the costs were cut like 20%. So our margins can be better than before. But then we got a war and we got the energy cost crisis. So in Europe, and I think all around the world, but especially in Europe, our costs in some clubs got up like 200%. So all the money we saved on staff, on other costs, on efficiency, whatever, we just lost in 3 months because of the cost of gas and electricity and water, etc. So this is a huge challenge, especially to operators with pools. We are seeing closure of public pools. We are talking about increasing physical activity, blah, 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 but we are losing facilities all around the world that people just cannot afford to pay the costs. So this would get especially young kids and older adults with less spaces to do physical activity. So that's a huge threat to our industry. If the costs continue to climb, there's only one way out: is to do a efficient facility, like a low cost or a small facility. Water activity will be over, but I'm still optimistic that if you manage well your club, you can afford to have a pool. But the energy costs are going through the roof. Some of our clubs just tripled the annual costs on these three parts of the clubs. Also, we are facing all around the world a wage increase because you have inflation in Europe is about 8%. You have to increase wages. If not, people will stop working for you. So it's only so at the end of the day, we saved some money, but then we had to spend it all over again. So maybe we are facing a huge change in business models, or you go through the roof on the premium part of it and charging a huge amount of money to people who can afford it, or you go to the down to the pure low cost and do it no frills, almost without staff, and just run it. We just opened a brand in our clubs called Element. We charge €2.99 a week, so around 13 euros a month. So we go through, because we almost don't have costs. So I would imagine if the energy costs stay the same, we will build new clubs that can face this kind of increase on energy. So at the end of the day, we always change value propositions and models around what happens on the world. We saw that in the big crisis in 2008 with the low-cost movement going all around the world. Maybe we are in a new changing environment. Let's see.
What would be the conversations that are happening between health club operators, your end, to that point of the energy crisis? Like, what are we seeing right now? Because I can imagine some businesses, yeah, you're in the phase of recovery, but you haven't necessarily recovered from closures that you experienced.
Yeah, we are still facing recovery of members. At the same time, we have to take really tough decisions to reduce temperature in the pool that affects younger people and older people, to adapt the temperature to your outside temperature. Easy to some operators. You have to do some investments to try to save some money. And we are 2 years ago, we saw these investments and we said, well, you have a payback in 15 to 20 years, so we're not going to do it. And right now, we can see faster paybacks because the cost of energy is so high that some capital investments on efficiency could help doing this, because operators have facilities with 10, 15 years that are not efficient. Right now, we are doing a lot of things around that. Some operators we are talking to are changing their model, so they are downgrading or upgrading memberships. You cannot be stuck in the middle. So or you market yourself as the price, the smallest price, or you market yourself as the best quality. If you are stuck in the middle, you are not the best quality, you're not the best price. These clubs are having some problems because the way to communicate with the audience is difficult. So I was talking with a Spanish operator this week, and they were saying that some low cost operators went up, increased their prices to try to get closer to the premium market. So they are shift up, and some operators are shifting down. So you can see shifts on this kind of models. The other thing is happening a lot in the world, as you see the fitness industry in the last 30 years, is that generally prices are increasing. It's the first time I see price increases all across the industry. I just saw it, Pure Gym and the Gym Group in UK charging 30 to 40 pounds a month. They were quite cheaper 10 years ago, 5 years ago. So if you see the landscape of fitness since the 90s until now, we dropped prices. It was the opposite. So now we are looking again at inflation pricing. So we at least go with inflation, increase prices with inflation. We are seeing some movements, but yet at the same time, when you increase prices, you leave room for others to come with new models, with more efficient clubs to go down and to offer. As you know, we look a lot of on data and usage. This new generation, the Z and also the X, they love doing strength training. So if you have a big box club with all the strength equipment, and it's cheaper than the other one, and cheaper than cardio, maybe you can get, like we have, the Element model and that goes below the low cost or the medium market pricing point, and then you get these people inside their gym. So if that's an opportunity to increase because everyone is increasing, but you will leave a gap that someone will fill sooner or later. So we have a lot of movement. I see a lot of movement on the industry, but and at the end of the day, I think it's always good. Of course, if you are in it and you are suffering, it's not so good. But for the customer, I think it's a good movement.
So on that note, obviously, we did discuss a lot of the challenges that are being faced right now. Where do you see the most promising or optimistic opportunities for people in the fitness industry and health club operators?
There's obviously, no one talks about it. It's the elephant in the room. The number of people in our countries that are above 65 or 60 years old is just enormous. Life expectancy after you retire 30 years ago was like 6 to 10 years. Well, our social security depended on being small because you cannot afford it. Nowadays, if you retire at 70, you could get 30 years of life expectancy after you retire. So what happens is you have to have function. That's the most important part when you are old. Have function, be independent. So there's only one drug to do that, and it's called exercise. It's the only way to keep function. The only way. So if governments want to increase the life expectancy of people and not to fall apart in health and social security, wherever, is to give them places to work out or to maintain an active lifestyle. So I see a huge gap in over 65 offering. We don't have it.
So
The
true.
only we have is medical-based facilities. Do you remember what I talked about? Medical facilities like hospitals. I'm scared of it. And we have normal clubs that have aqua gym or Pilates or yoga that attract a more old, but it misses the main part of it, strength training for older adults. And we have science. We have a researcher called Mikel Izquierdo in Spain that is also in the medical council of URSA, that has studies around people of 90 to 95 years old that increase muscle mass and increase life expectancy because they are induced in strength training programs. Of course, supervised in safe environments. So I'm pushing again to the WHO report. You cannot have free spaces if you need supervision, instructors, and safe environments. You have to pay to instructors, and you have to build spaces. So when you look long term, you look at older adults. Portugal will have 40% of their population above 65 in 10 to 20 years. So what are we going to do with them? Just leave them in their homes looking at the window or in the TV? That's not possible. And drugs will keep you alive, but in bed. So if you face the option, do you want to live until you're 100 years old, but living the fullest, being independent, traveling, doing normal things? Or do you want to live 20 years on a wheelchair or in bed, you are alive with drugs, and then you die? So I think it's obvious what you want to do. You want to have function. So we will have to build models that attract the two parts, the cognitive part of the business and the motor part of the business, the function, the strength, and also the cognitive. Health clubs do really well the motor part of it, the function. We are not yet on the cognitive. So we have some things related, but we have not Alzheimer's disease, mental issues. We are not into that right now, but we will that. The function part of it, we are the best. We have the machines, we have the systems, we have the instructors, we have all the setup needed to get people on board and doing the activities. So I think this model will be obviously a huge trend, and we'll have. And just imagine that this kind of population, they have money. So we will not compete by price. We will compete by quality of facilities and quality of the programming. So people will pay 200, 300, 400 euros to get function because they value health as a first priority. Of course, younger people do statics, but older people do health and life expectancy. The other part of it is, and I'm really optimistic about this, is I think the social media platforms help to deliver the message. Influencers that are healthier, younger people are healthier. My daughter and my son worry about being healthy, that my mother and my generation were not so worried. They asked me to eat certain things that I didn't care about. So they look and they learn about being healthy, and they look at people on influencers and other people talking about being healthy, not only healthy but sustainable, and to live in the better ecosystem. So these kind of folks are more into gyms. That's incredible, because they love to work out. They work out because they want to be healthy. They work out, of course, they want to look great, but they have that concern. So if you have the younger people going to the gyms, the future is okay. Because remember, the baby boomers right now, almost every one of them only had physical activity in their schools, on their sports activities. They were not born into fitness activities and gyms. So imagine a new generation having experience on going through gyms. So it's easier to adapt a habit in the future. So that's why I see uh, a huge increase of penetration all across the world on fitness activities and gyms. There's a third part of the equation that I feel that we control content. You know, when we closed, we had like 200 instructors at home, and we started delivering content.
Thanks.
And in 1 month, we got so many articles, so many training plans, so many exercises that now we have our physical assessment platform has our own exercises because we filmed it and we took pictures of it. So we see content as a new way of delivering our service. So we will never be Apple or Google or wherever they are, Peloton, that do their work really well on streaming, etc. But we have the content, so maybe we can do anything or about the content, because at the end of the day, you need instructors at least to get the content in. So I can see older people, I can see younger people going, and I can see the digital still going that way. I'm not the one to say gyms will be over or we passed the storm, digital is over. So we still face some challenges in the future.
I think it really is. You're so right, though. It's about building that bridge between the two because they work so well in tandem. I'm an avid gym goer myself, and you do notice there's people that bring their phones in and clip it on the wall, but like they're still in that physical space and it's part of the community. And through the last couple of years, I think we've realized more than ever how imperative community is to the human experience. So I have to agree with you. And then especially when you speak to that older populace, because as soon as you said it, I was thinking of all the spaces that I had been even within the last 6 months. And it's so very true how underrepresented, but our aging population needs interaction, and loneliness is a killer. Like when you look from the mental health perspective alone, it all seems very obvious to us, but I think it's more and more conversations like this. And when you speak to the influencer aspect, even on ATFW, that's why I started a podcast series of industry and a podcast series that's our influencer or celebrity series, because together, we all really do have the same belief and message. We all know to the core, this is what we need to ultimately be a successful batch of humans in the world. So I really appreciate your tips today. Before I let you go, I do like to always hear an inspirational mantra or a quote that you live by, because everyone's got a good one in there.
I have a mantra / advice to operators all around the world, is that we are not gym operators or gym providers. We are physical activity providers. Keep that in mind, because if you are gym operators, you only focus on your walls. And if you focus about being physical activity operators, you will expand your scope to everyone, everywhere. So that's the biggest shape we had with COVID. We can give services all around the world if you have a camera in front of you. So we are physical activity providers and not gym providers.
Love that. So very true. Well, thank you so much. I appreciate you having a later night on my behalf. But really, really good information and perspective. So I so appreciate connecting with you.
Well, thank you a lot.
You've just listened to All Things Fitness and Wellness, the Industry Series. This episode was brought to you by the British Columbia Personal Training Institute. Learn how to train, gain, and retain clients. New episodes of the Industry Series drop every Monday and the Celebrity Series every Wednesday. Don't forget to hit like and subscribe so you never miss out on hearing from industry thought leaders and influencers. We are on a mission to help everyone live a life fit and well.